Hello, wonderful people. Dr. Lisa Faast here with Diversify RX. And I have an old friend of mine and definitely a friend of independent pharmacy, Kris Rhea. Many of you probably know him from BIOLYTE. He has probably talked to someone at your pharmacy. I think he's probably the one person in the entire country that has literally talked to every independent pharmacy. But we are not going to be talking about BIOLYTE today. Well, maybe a little bit. We are going to be talking about ACOs. And so before we dive into those, Kris, I just want to say thank you for joining me. Thank you for bringing this topic up. I think it's an important one that I really haven't thought about. So thank you for kind of pushing that forward. But for somebody who may not know you or recognize you, go ahead and give us a little introduction.
Yeah, thanks, Lisa, for having me. My name's Kris. I've been working in the independent pharmacy business for about a decade now, and just really am passionate about, the community service model that independent pharmacy is all about. And I've just had the privilege to get to know so many people in this industry and go out and visit stores, and it's just been such an excellent opportunity. And, I'm passionate about researching and seeing what's on the horizon. So accountable care organizations are something that's pretty important to community health, and it's being an initiative of Medicare right now. And we need to find out how pharmacies can utilize their strengths to get involved.
Yeah, so ACOs, and this might be something as a pharmacy owner, another acronym in our pharmacy alphabet soup. And I think, whether a pharmacy owners kind of ran into an ACO, if you will, before, maybe depends on where they're at geographically. As I've owned pharmacies in many different states, and I've actually lived in some different states. In some states I've lived in, they were nowhere to be found. And in other states, they were everywhere. Every doctor was a part of an ACO, and there was no such thing really as independent practice anymore. And so give us an overview of what an ACO is. What is its function? Why do they exist? And, why do we as pharmacy owners, we can kind of get into why do we need to care about them?
Right. So what an ACO is, it's a multidisciplinary provider group where Medicare is incentivizing health systems and general practice and other disciplines to essentially collaborate and share information and share just care plans with one another to really reduce the risk of chronic disease. So in healthcare, in the past, we've all pretty much operated on silos, and that's really been a disincentive for chronic disease management. And when Medicare paid just for volume-based care, that really worked from a financial standpoint, but now that's just not sustainable. So what Medicare is doing is they're saying, hey, look, we will give you a bundle of money, and the more efficient you are and the more you can collaborate and work through these patient populations and the high risk patient populations, then the more you're going to get to take home.
Yeah, so really kind of what it does, going how you talked about Medicare gives a bucket of money, is it kind of removes the risk from Medicare. So if they have 100 patients, with an ACO, they're going to pay that ACO a flat per patient fee. And so they know exactly what their costs are. And it's up to that ACO to efficiently use those dollars. And so they like to do things like preventative care, and they like to do early detection because that will save them money. And they basically only get paid in terms of bringing home the bacon, they only get paid of what's left over. So if they poorly spend that money and provide a lot of unneeded or wasted care, then they're just taking it out of their own pocket. So it is a unique way of how to handle care where there isn't just this unlimited faucet that's going to keep paying for services. You need to work within basically a budget for each patient. And, when I lived in Florida, ACOs were everywhere. And I don't know if that's just because of the maybe senior population of the snowbirds or whatnot, but it seemed like ACOs were everywhere. Whereas where I was at in California, I never ran into them as a pharmacy owner. And maybe that's because we had Kaiser, which is kind of like its own, ACO entity. And so how can pharmacy owners, why should we care about ACOs? Where do pharmacies fit into that? Because you mentioned a multidisciplinary approach, which actually includes pharmacies in that. And so where do you see pharmacies and ACOs, meeting up for mutual benefit?
Oh, Lisa, it's going to be so valuable for pharmacies to get integrated into this system. Really the strength of community-based pharmacy is that relationship that they have with the patients, the drug optimization and utilization aspect of it, And then the education, because of that trust relationship, the pharmacies are accessible to these folks, and they can really, be on the ground floor doing basic level testing, basic level screening and education. And the neat thing is a lot of the pharmacies are already doing the things that the ACOs are graded on, like medication adherence, immunization completion rates, things that are really important and very transparent. One of the cool things about ACOs is that all the data of how they're graded, what they're graded on, what they are currently doing well and not well is right there on the internet for anybody to see. And then you can see all the providers and the medical director of the ACO that you're looking into. So you can reach out to those folks and see if you can get involved. But independent pharmacy obviously is being challenged right now with, dispensing reimbursement. So getting integrated into these contracts with these accountable care organizations and helping them meet their metrics, that is a way to, get payment for that education and strength that you have in community pharmacy.
Yeah, I think a lot of these ACO organizations kind of recognize the value of the pharmacist. And I'll be honest, that it's probably more of a monetary, hey, we can pay a pharmacy less than what we can pay a doctor to do this same kind of service. So they may not be looking at us altruistically, but I think it's a great opportunity where we can step in and showcase, and maybe it's even get some practice, if you will, using that muscle for pharmacists and getting more experience so that when new things happen, or Medicare gives us provider status, or we work with, another type of organization, we get some of that under our belt and know how to navigate within these. So, whatever the motivation or intention is on the ACOs, they actually look very fondly at pharmacists. And I think it's something that we do need to take advantage of and become a part of that ecosystem, because we can perform a lot of those activities, like you said, that they're getting measured on for those Medicare patients. We all know about compliance. We all know how non-compliance leads to greatly increased medical costs, mostly because I like to when I usually tell lay people, it's not because they miss the dose that is the problem. I mean, yes, that produces problems, but it's that the doctor assumes that they never missed the dose. And so then they start to treat based on the fact that they never missed the dose. And that's where overprescribing and side effects and all of that come in. It's because we assume our patients are taking their medications. And so that's really where the focus is of the ACO is to reduce that expenses because they have a capitated budget per patient. So what would be your recommendation for a pharmacy that is like, this was kind of interesting? How would they find out if there's ACOs in their area? How would they know who to contact? What does that initial outreach look like?
Right. So all this data and information is on cms.gov. There's an innovation center link that you can bring up and put in a state or a zip code, and it will pull up any of the groups and what model that they're using in your community. And then you can research to see who is that medical director and reach out to them. And the playbook's already laid out for you because it shows you what that model is being graded on. So you can say, yep, we are proficient in this and we can help them with this. So that's a way that if you want to do it on entry level, to do it in your community, just look at cms.gov. If you want to get involved with some other opportunities, CPESN is obviously working to integrate pharmacies and use these clinical initiatives approach ACO groups and other payers, whether it be self-insured entities or health systems that are doing this type of model. So getting involved with your local CPESN chapter is a good opportunity. And then we have already done a lot of legwork in East Tennessee and Southwest Virginia. My local CPESN network that I'm affiliated with, we have a contract with an ACO that has seen the value in independent pharmacy. So they are working with us to scale that opportunity nationally. So they came to NCPA and did a CE, and we're at the NCPA CPESN booth, the medical director and the chief operation officer. And essentially what that opportunity would be is, hey, if you have providers that aren't part of an ACO or not happy with the affiliation that they're dealing with, Emergent is the entity, and y'all can look them up. They would vet them and get them involved in this model and give them access to an information exchange record that the pharmacies have access to as well. So you can communicate and see real-time data. And then care planning from the CPESN network is going into this database. So that would be an excellent opportunity for pharmacies to essentially reach out to providers and say, hey, this is an opportunity for you to get involved in value-based payment. And then that there's already that built-in contract through the CPESN network.
I know, so CPESN network has tons of local chapters, as you mentioned. So if somebody isn't already like embedded with their CPESN local chapter, how do they go about finding who that is?
Yeah, so CPESN just redid their website. So if you get on just the CPESN USA website, there will be contact information for your state chapter, officer. And then all those officers have information on this opportunity. We're really trying to, Emergent said, look, this is a unique opportunity for us to really embed independent pharmacy into the practice. They've seen how well it worked in Tennessee and Virginia, and they've even been able to help us leverage getting a better contract with Caremark on our Blue Cross Blue Shield drug dispensing contract. So, they have a lot of benefit to Medicare and to these insurance plans. So they're able to kind of use that clout and help us on the pharmacy side. And that's just part of the incentive for the pharmacies. There's the contract that states, hey, if you help us hit these protocols as a network, then there's incentive back to the stores.
Yeah, so there's the opportunity with Emergent, with CPESN, and then as you mentioned before, lots of communities have ACOs in them, and you can go to the CMS website. I think this is a really cool opportunity for pharmacies to collaborate with, other healthcare providers, collaborate with these particular patients, because we know that these are patients that need services, and the transparency of basically you're told what to go pitch them on, because you see what they're graded on, you see where they're excelling, you see where maybe they're not excelling, and you're like, hey, I can help you with that. Let's talk. And you can basically get embedded, and they're willing to share some of that bucket of dollars, as we talked about, with the pharmacies in order to perform those services. And so this is a really unique opportunity. And I think, it just helps you network better in your community, learn of more organizations and more pathways in order to expand your services. So if somebody's interested in kind of finding out what Emergent is doing with CPESN, what are the next steps for them?
Yeah, definitely. So we have a Jotform that, I'll send to you, Lisa, and they can fill out information about, just their interest, and we'll have somebody reach out to them and give them a little bit more deeper detail about what we can do to help and what we're looking for in terms of partnerships with some of the providers in the community.
Awesome. And I am not going to let you go without talking about BIOLYTE, because my husband would be very mad at me because he loves BIOLYTE and he wants everybody to drink it. Tell us a little bit, if somebody's never heard of BIOLYTE before, really quick, what is BIOLYTE and why should they care?
Yeah, thanks, Lisa. Yeah, it's a really innovative product. A physician made this when his wife had breast cancer. Essentially, he made an oral IV bag. So it's got the electrolyte formulation of the IV, equivalent to about 6 to 7 sports drinks from an electrolyte standpoint. And then he's added stuff for nausea and liver functioning. So it really helps you recover if you're dealing with stomach bugs, sickness, heat, exhaustion, cramping, and it's got minimal sugar. So diabetics can use it and not really have the risk of as much blood sugar spiking. It's something that you can, purchase through your full line wholesaler. We're stocked in the wholesalers now. And then if you need any resources, we have point of sale material I'll send to the store. Or if you just want to sample it, before you bring it in, please reach out. I'd be glad to collaborate with you.
Yeah, it is a powerful drink. It is potent, but it's not just for people with cancer. I mean, like you said, sports athletes, my kids drink it, after practice and things like that. When we're doing extenuous labor, when we're just get dehydrated. I mean, it's a good all around drink. So it's perfect for pharmacies. We are in the middle of flu and respiratory season. I know strep throat's going around really bad here in our town. And so every time you dispense an antibiotic, every time you, have a little shelf talker, put it right up by the cough medication. We all know we don't drink enough fluids when we don't feel good. And so this is a great way to increase your hydration or to stay hydrated. So, well, Kris, thank you so much for chatting with us. I love the ACO opportunity and the angle. And if you are interested in that Jotform, we will post it in the show notes and in the comments below. And feel free to reach out to Kris Rhea over at BIOLYTE. We'll put his contact information there if you want to give BIOLYTE a try. And just thank you so much for your advocacy and friendship of independent pharmacy. It certainly does not go unnoticed. I know I greatly appreciate it, and many others do too. So thank you.
Yeah, same here, Lisa. I love everything that you do for the community pharmacies and just the digestible information that they can take from your website and your group and this podcast.
Awesome. Thank you so much. And we'll talk again soon.